I hope you're fine. Dental checkup and annual dental visits are very important for oral health. Whenever we neglect our oral hygiene or oral health, then the consequences are very dangerous. For example, when there is start of tooth decay in our teeth or tooth, a sign of black spot in the teeth, if we neglect it, and even when there start of pain in that particular tooth, we cure it with home remedies like application of clove oil or any analgesic or painkiller to relieve the particular problem at home. The process of tooth decay will continue. It will not stop by itself. We need specific treatment for tooth decay, a specific restoration or application of fluoride, casein phosphate, or some fissure sealant prophylactically to prevent or reverse the tooth decay. If we neglect, the ultimate fate of that particular tooth will be tooth extraction and in future replacement with artificial prostheses like partial dentures, fixed partial denture or dental bridges or dental implant. But always prefer to save your natural tooth, which is a gift from the nature to you for mastication, phonetics, and aesthetics. Second important thing related to dental checkup is gingivitis, inflammation of the gum tissue, and patient presented to us after using a lot of home remedies, and when their teeth start to severe pain and mobility, then they present to dental clinic. But at this stage, the prognosis of the treatment will not be that good. Early diagnosis and early treatment favors good results and good prognosis of any disease. Like start of gum disease is gingivitis, which is purely a reversible condition, which we can cure it with ultrasonic scalers or Gracie curers. We remove tartar or calculus from the teeth surfaces and polish them, and also guide or instruct the patient to brush in vertical direction and use a soft suitable toothbrush to clean the teeth before going to bed and before the breakfast with the help of a suitable toothpaste containing fluoride or xylitol. If patient do not come or visits any dentist for regular checkup, there will be a big loss to him or her as tooth decay lead to tooth extraction, gingivitis lead to periodontitis, mobile teeth, and we have to extract them. And another important thing is ulcers in the mouth. Ulcers are very dangerous. If any ulcer in the mouth will not heal more than 15 days after its appearance in the mouth, then we can suspect it as oral cancer. And if patient neglect it and do not visit to dentist, the ultimate fate is very dangerous as cancer will spread to other body parts, metastasize, and damage the whole body system of a human being. So it's better to visit your dentist at least twice in a year biannually to rule out the problems you are facing in your oral cavity. Your dentist will visit your face problems like enlargement of the salivary glands, any marks or swelling on the face, lymph nodes enlargement, muscle mastication, spasm or contraction, and then we'll inspect the intraoral conditions of teeth and gums, whether there is tooth decay in any tooth or teeth, clinical observation as well as with x-rays he can rule out the start of tooth decay in your mouth. Plus he also examine the gum tissue in your mouth whether the gum is receding or either there is bleeding or sensitivity from the teeth. So early detection is very important. If early detection in the examination happened, then it will be very fruitful to the patient. As in case of gingivitis, just simple scaling and polishing will cure the problem, and after 2 to 3 days, the gums of the patient will be back to the normal. Same in tooth decay. Early tooth decay is reversible. We can reverse or remineralize it with fluoride application, GC tooth mousse or casein phosphate, or with the use of xylitol chewing gums or xylitol toothpaste. Plus modification of patient diet, less sugary diet, less intake of sticky food, more intake of fruits and vegetables, and I always stress on brushing before going to the bed and before the breakfast. And dental floss once a day is very important for interdental cleaning, or you can use interdental brushes to clean the area between your teeth. These two things are very important for oral health of your teeth and long-term survival of the dentition. Hopefully this video will be helpful to you and you will must visit your dentist twice a year at least to rule out the problem which are starting or emerging in your mouth. So kindly subscribe and like the channel, and any question related to today's video you can ask in the comment box. Thank you.